start with a dissected specimen first. And what we're going to see is some of the blood vessels and some of the structures within the pelvis and the pelvis wall, etc. So we're just going to orientate ourselves first. We can see here is the pubic symphysis, and we can see the sacrum, and it's rather curved in this individual. And then when we go into the pelvis, we can see the bladder with the urethra. And at this stage, we cannot tell whether it's male or female, but we are not interested in that in a minute. We're going to see that we have the internal iliac artery, and you can see over there is the posterior division, and here is the anterior division. Now, as you can see, not all of our specimens contain all the branches, so we have some of it. Let's look at the posterior division first, because that is more clear. We see here is the iliolumbar artery going back over the ilium to the lumbar area, and we can see the lateral sacral artery in this position, and this huge artery, and it makes a very characteristic curve here. That is the superior gluteal artery. If you go to the anterior division, not much is left here except the inferior gluteal artery. And if I turn the specimen over, you will see why I say that. And then, of course, the sacrolumbar trunk, as well as the other structures that makes up the sciatic nerve, which we will meet tomorrow in the lecture. Just going to turn this around, and you'll see this is the gluteal region, which we will dissect tomorrow. I'll give you a head start. You'll see this is the piriformis muscle, and everything above this is the superior gluteal something, which is meaning the nerve, artery, and vein, and up down here is inferior gluteal something, nerve, artery, and vein. So the arteries from the inside of the pelvis actually comes to the gluteal region to supply this area, and this is the artery that we've seen. But we won't ask it like this. We will turn it around and ask you, what is this artery? And that would be the inferior gluteal artery. Okay, now we didn't see most of the other arteries from the anterior division, but I would like to show you here. You can see this is the anterior division, and now we can see one or two extras. One being, unfortunately, this unfortunate obturator artery that follows the obturator nerve into the obturator foramen that goes into the medial aspect of the thigh. This other divisions, now we can see the inferior gluteal artery here, and this one that was not visible on the previous one, which is the internal pudendal artery. Remember, the internal pudendal artery is very special as it exits the pelvis and then comes back forward, as you can see here, in the company of the pudendal nerve and the internal pudendal vein, and runs past the rectum, and I'll show that to you in another specimen, to supply this perineum. Okay, so this one exits and then comes back, and he makes a very characteristic loop posterior to the rectum and to the front to supply the perineum. Into the pelvis, again, let's orientate ourselves, a mid-sagittal section through the pubic symphysis. You can see anteriorly, you can see the curvature of the sacrum posteriorly, and almost nothing is left in the pelvis, but I would like to show you the muscles. There are two muscles of importance here, and that is the levator ani muscle. This is levator ani. You can see it's extremely thin, and remember, it runs like little buckets in the pelvis, and all we can see is half of it. Okay, so it looks very thin here. The other big muscle that we can see here is actually obturator internus. Now, obturator internus is one of the lateral rotators of the thigh, which we will meet tomorrow. But it already starts within the pelvis. It covers the obturator foramen, and you can see the obturator nerve also indicates the position of the obturator foramen. So this muscle originates over the area of the obturator foramen and then exits the pelvis posteriorly to act on the femur. Okay, so there's a difference. Don't get confused. The one is a very thick muscle, and the one is a very thin muscle. That's also some of the criteria you may use. If we're going to, we have now in this specimen removed most of the, all the muscles of the wall of the pelvis, and left a few biltong pieces. As you can see, some of the arteries look dried out, but we are not going to look at that at the moment. You can see the sciatic, the ischial spine, and the sacrospinous ligament over here, and you can see sacrotuberous ligament here, and that creates the greater sciatic foramen, and you can see the start of the sciatic nerve going posteriorly, and then the lesser sciatic foramen, of which the internal pudendal artery uses to come back into the front of the perineum. So these two ligaments also sometimes asked in a test. Right, if we look at the pelvis with contents, and this is female, how can you tell that? Because you can see this uterus over here. Let's start anteriorly: pubic symphysis, urethra, bladder, vagina. You can see posterior fornix there, and anterior fornix over here. And the uterine cavity looks a bit strange because it's not straight cut through the uterus, it's sort of off center, so it looks a bit strange, but uterus nonetheless. And posterior to that, the rectum. If I put the pin in here, it's the vesico-uterine pouch. Okay? And if I put the pin posterior here, that would be the recto-uterine pouch. Okay, so try to remember recto-uterine pouch instead of pouch of Douglas. So this is how we mark the pouches. Then the broad ligaments. I've opened the uterus. You can see the fundus of the uterus. You can see the broad ligaments over here. And we usually tie a string around it like this, so that's it. So that and that's what we ask the broad ligaments. And you can see, to distinguish between the structures here, we follow this structure. This is the uterine tube, and you can see it's uterine because we can see the fimbriae over here before it ends in the infundibulum, ampulla, and then isthmus into the uterus. So the fimbriae of the infundibulum is very useful in order to confirm whether you're looking at the ligament or at the uterine tube, in this case the uterine tube. Now, this round almond structure below that is the ovary, and there's this ligament that attaches the ovary to the uterus. Now we know the mesovarium is a double layer of peritoneum that attaches the broad ligament, ovary to the broad ligament, and is in this area, but it's very small and not very clearly visible here. All right, but remember the definition. All right, I'm going to reflect all the structures from the pelvis. I'd like to show you this interesting structure. This is a bony protrusion, and obviously this person had problems because the obturator nerve, as you can see, is close to this protrusion, and any pressure on this obturator nerve will refer pain to the medial aspect of the thigh. This is a mid-sagittal section of a male. Now you can't see the penis. Let me show you what to look for. Let's start anteriorly here. Pubic symphysis, and we can see the sacrum posteriorly. We can see the bladder, and what makes this male, what tells me that it's male, is the prostate, although not cut exactly in the midline, but we can see the seminal vesicles here. So that makes it male definitely, with the rectum here. And if I put usually they have peritoneum, but that would be the vesico-rectal pouch in the male. If we lift this up, we can actually see the ductus deferens here. As it comes through the deep ring, you can see the relationship to the inferior epigastric artery as well as the rectus sheath, and you can see how the ductus deferens passes through the ring, posterior to the bladder, and where it inserts into the prostate. So this is the area of the prostate, and this seems to be sort of the beginning of the prostatic urethra. This is a specimen that you need to orientate yourself. This is a posterior view, so we're looking from posterior to anterior in the male. You can confirm it by the scrotum that we can see here, and of course the prostate, and you can see the prostate has been opened on the one side to show how the ductus deferens enters into the prostate and to enter into the prostatic urethra. So we are looking here, if I point to this structure, to the ampulla of the ductus deferens, and you can see the seminal vesicles, and we can see, if I put it there, that's the apex of the bladder, and of course we can see the rectus abdominis and again the inferior epigastric artery. Okay. So it's a very nice specimen, and I would like to point this structure out to you. This is the bulb of the penis, so this structure lateral to it, that would be the urogenital diaphragm. Okay, so you can see it's not a specific area, it's sort of undefined, but you need to look at the position of it, which makes it easier to identify.